Dr. Swaminathan. Next question goes to Michael Bociurkiw from CNN Opinion. Michael, please unmute yourself.
Thank you for taking my question. It's been a while. Good to be back. My question is the following. Vaccine diplomacy has become part of our COVID-19 lexicon. However, it seems that many of the countries are engaging in the diplomacy not simply for altruistic reasons. What I mean by that is many recipient countries are being strong-armed to guarantee market access or adhere to an unwritten set of diplomatic rules. I was wondering if you might advocate a kind of set a code of behavior rather for countries engaging in vaccine diplomacy, because I think a lot of countries that are poor, and Dr. Tedros mentioned the poor countries are not getting enough vaccines, but a lot of them, I think, are getting into situations which they might regret later on. And just quickly, the numbers are quite startling. China is donating free vaccines to 69 countries, commercial order to 28 others, Russia, Sputnik vaccine to 70 countries. And finally, as we know, India is also exporting, and with them and China and Russia, all three countries, their domestic vaccination rates are very low. So can some kind of better code of conduct be advocated here? Thank you.
Thank you very much, Michael, for this. Let me look around. Maybe start with Dr. Bruce Aylward. Thank you very much.
Thank you, Christian, and Michael. Thank you very much for the comment. We're not in a position to comment on any of the conditionalities that have surrounded the donations of vaccines to one country or another. We actually don't have a good sense of those. In terms of a code of behavior, Michael, what the COVAX facility, the whole concept of COVAX, is the code of behavior that we've been urging that should underpin the global rollout of vaccines. And that is that we have a common approach, a common framework, a common rollout of these products to make sure that they go to the countries and populations that need them most, based on the principle of equity that we've been talking about all along. And the goal, of course, is a rollout first to make sure we protect our healthcare workers, make sure we protect our older populations, most at risk of dying from the disease. And it was recognized over a year ago when we started to try and develop vaccines, that as we did so, they would be an incredibly scarce supply from the outset. So the establishment of COVAX and the allocation mechanisms that underpin it were putting in place a global code of behavior, in effect, that would try to address some of the challenges that you referred to. And in that code of behavior, what we are promoting is global cooperation through a common process with complete transparency on who's getting which vaccines in what order, and then with as many possible doses as possible through the COVAX facility, so that we can ensure the equitable rollout, that populations, countries that may not have the relationships, geopolitical or otherwise, that would make them favored candidates for donations. Countries should not have to rely on the favor of others to be able to access vaccines in a crisis like this. So the code of behavior is very much anchored in the principles that underpin the COVAX facility.
Thank you very much. That was Dr. Bruce Aylward, the Special Advisor to DG and the lead on ACT Accelerate, and Mariangela Simão, please.
Thank you. Michael, let me add to what Bruce was saying in terms of the COVAX facility being an equitable access mechanism that we are very much working on and striving to get enough doses to be distributed. I would say we also need a change in the, it's not necessarily the code of behavior, but I think we are seeing also, we're living in a world where many of the producers are moving towards a profit-driven approach instead of an equitable access approach. So WHO is pushing very hard at the highest level for everyone who's manufacturing vaccines to consider seriously putting these vaccines in a global mechanism that will ensure that all countries have access to them, not only high-income countries who can pay more for the vaccines, as we're seeing, as we speak right now. So I think that the code of behavior, when we're talking about it, is not only for vaccine nationalism, it's for everyone who has a product that can be a public health good and can help us end this acute phase of this pandemic. Thank you.
And the Director General, please.
Yeah, thank you. I mean, just wanted to say a few words. In international relations, there are three ways of engagement, as you know. One is cooperation, the second is competition, and the third is confrontation or conflict. You can choose from the three C's. To end this pandemic, the only choice we have is cooperation. Vaccine diplomacy is not cooperation. It's actually a geopolitical maneuvering. So it's the clear and clean cooperation that can help us to end this pandemic. I don't think this is really something that many don't understand. Everybody understands it. But from WHO side, we have been saying, we cannot defeat this pandemic through competition. We can't. If you compete for resources, or if you compete for geopolitical advantages, then the virus gets advantage. And if there is confrontation, that even is the worst. And we have seen it, by the way. There was confrontation that undermined the whole response, especially last year. So the choice is clear. Cooperation, global cooperation, and global solidarity. And that needs actually a very basic principle of identifying the virus as a common enemy. So there is clarity on who the enemy is and how it has to be tackled. It's a virus, a common enemy, that can only be tackled through cooperation. So that's what we are saying repeatedly. And what you said, thank you so much for this very important question. It's undermining or delaying the end of this pandemic. Again, we repeat, the only option is cooperation. No competition, no confrontation or conflict. Confrontation, competition, and confrontation helps the virus. Competition and confrontation or conflict divides us and again helps the virus. So our choice should be cooperation. Thank you.
Thank you very